All right, if you're a chiropractor, you know this feeling. You have a patient, they're in, with that same persistent pain, you run all your standard tests, and everything comes back negative. So today, we're going to dive into a completely new way of looking at evaluation, one that really moves us beyond just subjective feedback and into the objective future of neurologically based care.
You know, this quote from Dr. Ted Arkfeld, it just hits home, doesn't it? It's that frustration you probably feel in your practice almost every single day. You rely on these tests, they're foundational, but you also know their limits. They're the tools we've got, but are they really the right tools for the complex cases walking through your door? I think we all know the answer.
And that, right there, leads to the million-dollar question. This is that moment in the exam room where you could just feel the patient's confidence start to waver. You've run the tests, everything comes back normal, but they're still in pain, and you're left there without a concrete, objective answer. That gap, it undermines your results and it undermines your credibility as a clinician.
So let's just formally break down what these limits are. Understanding why these traditional tests are falling short is really the first big step toward finding a much better way to practice. I mean, this list really just sums up our daily challenges, right? We're dealing with subjective interpretations that can change from one doctor to the next. The results? They're usually just binary, a simple pass or fail, which totally misses the whole spectrum of dysfunction that exists in between. And after all that time spent on the exam, they often fail to explain why the patient is still struggling, and that just erodes confidence on both sides of the table.
And look, this isn't just a clinical problem, it's an identity problem for our entire profession. These outdated tools are directly connected to an outdated perception of what we do. When we use limited tools, we get limited respect. We are so much more than back doctors, and it's time our evaluation started reflecting that reality.
This chart just lays it out so clearly. It shows the massive shift we're talking about. We're moving from the old way, which is subjective, it's based on chasing symptoms, and it's pretty passive, to the neuro way. And this new approach, it's objective. It's based on the neurology of actual movement. It provides real answers that lead to active, targeted rehab. It's a complete philosophy upgrade for your clinic.
So, now that we've clearly defined the problem, let's get to the good part, the solution. And this is all about a fundamental shift in how we think about and how we interact with the human nervous system.
And this is it, the Neuro Sports Performance Evaluation, or NSPE. Now, this isn't just another test you add to your lineup. It's a completely integrated system. And the key word here is integrated. It combines objective movement data with neurological feedback to give us a clear, full picture of that brain-body connection.
And this is the core concept. This is what it's all about. We're not just observing that a patient's shoulder has limited range of motion anymore. We're using technology to understand why the nervous system is putting the brakes on that movement. Is it a sensory mismatch, a motor control problem? The NSPE helps us get right to the root neurological cause.
This right here is the principle that changes absolutely everything. Think about it. When you can show a patient objective, measurable data about their own body, the whole conversation shifts. It goes from being about your opinion to being about a fact. That builds trust, it boosts compliance, and it empowers the patient because they can literally see their progress.
So, you're probably wondering, how is this even possible? Well, it's not just a theory. It's powered by a suite of technologies that all work together. Let's take a look at the 4 pillars that make up the entire NSPE system.
So, first up is NeckCare. We all know how incredibly important the cervical spine is. This tool goes way beyond just looking at someone turn their head. It gives us precise, hard data on range of motion and, even more importantly, on proprioception. You know, the brain's GPS for where the body is in space. This lets us pinpoint those sensory mismatch issues, where the brain's map just doesn't match reality. And for our concussion, whiplash, and balance patients, this is absolutely critical.
Okay, next is Kinetisense. This uses some amazing markerless motion capture to give us a full-body 3D movement analysis. This is where we can actually put a number on asymmetries and stability problems during dynamic movements, like a squat or watching someone walk. It gives us an undeniable objective baseline and then the ability to prove that neurological change with follow-up scans. You're not guessing if they're better, you're measuring it.
The third pillar is BrainTap. Now this is really cool. It brings the brain state right into the evaluation. It lets us assess and even train the autonomic nervous system. We're talking about things like stress response, focus, and recovery. It finally connects the patient's physiological state to their functional outcomes, a link we've always known was there, but I've had a really hard time objectively measuring, until now.
And finally, we have NeuFit with the newbie system. This is what closes the loop. After we use the other pillars to find those dysfunctional neuromuscular pathways, the NeuWay lets us use a unique direct current to immediately go in and activate and retrain them. It bridges that gap seamlessly from a super precise assessment right into a targeted, effective treatment.
So when you put all of these pieces together, you fundamentally change your entire clinical workflow. You literally move away from the world of educated guessing and into the world of precise measurement.
So the new process is this simple but incredibly powerful loop. First, you measure to get that objective baseline. Second, you treat with targeted interventions based on that data. Third, you remeasure to prove that it's working. And fourth, you empower the patient by showing them the visible, undeniable proof of their progress. It's reproducible, it's trackable, and it's completely transparent.
And let's be crystal clear about something. Despite the Neuro Sports name, this is not just for elite athletes. This system is designed for the patients you see every single day, the post-surgical rehab case, the person with chronic pain who feels like they've failed everywhere else, or the elderly patient who's struggling with their balance.
Adopting a system like this isn't just about getting a new piece of equipment for the office. It's really about deciding what the future of your practice, and frankly, our whole profession is going to look like.
This is the evolution. This is our opportunity to finally break free from that back doctor label and step into the role we were really trained for, a neurologically based movement doctor, a true expert in restoring the communication between the brain and the body.
And listen, this isn't some far-off future we're talking about. The demand is here right now. Patients who have been failed by the traditional system are out there, actively searching for a different solution. Dr. Arkfeld gets these requests all the time. They are looking for you.
Ultimately, what this is all about is becoming the answer for those patients who have lost hope, the ones who've been told it's all in your head, or worse, to just live with it. You can become the clinical solution that they've been desperately searching for.
The tools are here. The demand is growing every day. Patients are out there looking for a new way. So the only question left is, will you be the answer they're looking for?